Welcome to the Efficient Practice Podcast. If you want increased productivity, profitability, and a better quality of life, this show is for you. And now your host, Dr. Evelyn Samuel.
Hello, and welcome to the Efficient Practice Podcast. I am your host, Dr. Evelyn Samuel, and I am so excited about today's episode. I have someone on the show that I know you all are going to thoroughly enjoy. She is just a ray of sunshine, and she's doing some really, really great things. So without further ado, let's welcome Dr. Tontra Lowe to the Efficient Practice Podcast. Hello, Dr. Lowe.
Hi there. Thank you so much for having me this evening. I am so thrilled to be here, almost as excited as you are.
Well, I am excited. I've been wanting to do this for a while. I think you're doing some amazing things and some things that are going to truly benefit dentists and their patients. So I can't wait to talk to you about the things that we're going to talk about. I think the listeners are in for a treat.
Wonderful.
So, Dr. Lowe, as we get started with this interview, can you tell the listeners a little bit about what you're doing right now and how you came to that point? How did you get into doing what you're doing right now?
Sure, of course. I have been a dentist now for unbelievably a long time. And so, with that being said, as a graduate of Howard University College of Dentistry in 2005, I've been able to build a strategy to help not only myself in the things that I do on a day-to-day basis, but most importantly, to be able to help patients. And then, of course, to be able to reach out and help those who are also trying to help patients to do some things a little differently. As you know, being in dentistry, sometimes we can hear some negative things a lot. And so it not only bears and weighs down on the practitioner, but it can also weigh on the team members. And our goal is to always be able to help people as much as we can, because we truly believe when you change your smile, you change your life. Everyone
Absolutely.
should smile with confidence. And so as I've gotten here over the last few years, again, my goal is just to make sure that everybody can thrive, be happy, and again, be able to smile with confidence.
Absolutely. That's amazing. And so, like you said, you are a dentist. Most of our listeners are dentists as well. And when we're talking about dentistry
Mhm.
and we're talking about what we do, of course, we're there to help our patients. That's first and foremost, to provide a service. But we oftentimes find that with what we do, the big I word comes into place: insurance. And sometimes with insurance, um, it can be a lot for us as providers, as dentists, also for patients as well, because sometimes patients won't exactly understand, the difference between dental insurance and medical insurance and coverage. So you're helping dentists to do something a little bit differently, right, with the insurance. So tell us a little bit about that as well.
Of course, yes. And you're right. There are a lot of differences between medical and dental insurances. And not only is it difficult for patients sometimes to navigate, but a lot of times it can be difficult for dental teams and offices to navigate as well. What we have tried to do, actually, it's not what we have tried to do, it's what we have done. What we have been able to accomplish is to allow patients to understand and know other things about their other wallet. That's what we like to call it. It's their other wallet, which is their medical insurance. A lot of people have no idea that a lot of things that happen in their mouth can be connected to what is happening in the rest of the body. As dentists, we talk a lot about oral systemic links. We see patients every day who come in with all types of hereditary issues, all types of other medical conditions, and then they come in with secondary conditions. That means that they had one primary condition, and because of that, now they have other ailments that they are trying to keep under control. And sometimes it shows up in their mouth. I tell my patients a lot of times, your mouth is telling me a lot of secrets.
Mhm.
And let me ask you, do you know this? And a lot of times I say things and they're like, well, I don't understand. How do you know that? Or, I'm so happy to hear about these things that you're telling me because no other dentist has ever said that to me. We want to be as comprehensive as possible. And we want to try and help dentists be able to understand that there is another way to help patients get over that challenge. And we all know sometimes that challenge can be financial.
Mhm.
If we give them another avenue to be able to get their treatment done, simply because of the fact that we make them a little bit more aware of the consequences of inaction and then how these things in the mouth actually came about secondary to their medical condition, we can help them and we can help our offices thrive a little bit more and be a little bit more efficient in terms of how we process insurance payments and billings and how we're able to help our patients more.
Yes. I'm so glad you mentioned that, the oral, full mouth systemic links. Because like you
Absolutely.
said, oftentimes patients don't realize that your mouth is like a gateway. And like you said, it tells us as dentists a lot about the patients,
hmm
and it's all related. It's a system. And
Absolutely.
so, yeah, I'm glad you said that.
I
Do
like to
you
tell patients, sometimes those germs in your mouth, they like to take an Uber. Because most people understand Ubers. They know what an Uber
Yeah,
is. They know what a Lyft is. They understand transportation. I'm going to call. I'm going to get my app. I said, those germs like to take an Uber. They don't just stay in your mouth. They jump and hop and move and travel to other parts of your body. And when those germs, those really, really bad germs that cause so many issues in your mouth, get to other parts of the body, those body parts can be impacted as well in a negative manner. And you start to have all these other things happening. You don't want that. You want to try, you only want an Uber when you want to call one. You don't want these bad germs jumping into other areas of the body and doing and other things that they're not supposed to and wreaking havoc.
that's a very good comparison. Yes, it is. That
Most
is
people get
indeed.
it.
So I'm gonna have to use that. It's like an Uber.
Please do.
And I will even credit you.
Thank
Compliments
you.
of my friend, Dr. Tontra Lowe. All right. So I love it, love it, love it. Do you find that when you're working with patients and you're discovering these things, that there is obstacles or difficulty with access to care for the patients? Do you ever?
Absolutely.
Yes.
Absolutely. And unfortunately, a lot of times it's socioeconomic in terms of the negative impacts that you see. But it's not just that. You can have some of the most affluent people in your offices, and still they don't quite get the link between what's happening in their mouth and the rest of the body. Another thing I like to always tell patients, especially around where I am outside of DC, because of the fact that we have such a traffic issue in the DC, Maryland, Virginia area,
Mhm.
people know about the primary interstates that come through their area. I'm actually off of I-66 West. That's where my office is located in the Northern Virginia area. And I like to tell them, hey, if you're not interested in trying to get some things done, just remember your mouth is like an interstate. Sometimes things are getting clogged. Sometimes the flow is great. Sometimes you have no issues. And sometimes you can just all of a sudden have something that happens out of the blue when in reality, it just comes back to maintenance. And so if you had done a little bit more maintenance, been a little bit more proactive, sometimes you're not reacting. I'm a big proponent for being proactive and not reactive. I think a lot of our dental colleagues are the same way. We're trying to help patients to be able to live longer lives, smiling with confidence and being able to do those things that they love to do, like eat what they want, when they want to eat it.
Exactly. So tell me this. So I see you're doing an excellent job of educating the patients. When it comes to, and this is your area of expertise, I like to emphasize this to the listeners. This is Dr. Lowe's expertise in terms of helping dentists, the dental practices, to for medical billing. So there are some procedures that we do as dentists that could be billed through their medical. So how do you well, first, how did you discover that you were really good at this medical billing, or how did you get into medical billing?
It's actually a funny story. I tell it every time I have my course. Because it's true. And so, I believe in being truthful. I believe in being transparent when I can and when it's appropriate. But I actually had my office initially. I recently moved, but I had my office in a center where there was an optometrist.
Mhm.
And so one day, for whatever reason, our mail will sometimes get mixed up because we had one box, and sometimes I would get mail from him. He would never come back and return any mail to me, so I assumed I was the only one getting the bad mail from the other office. I don't know. He never brought anything else back to us. But one day I opened it up inadvertently because I thought it was my mail and my explanation of benefits for a patient. And I noticed that the doctor that actually checks two eyes was getting paid more than I was. And I have at least 32 teeth that I'm looking at any given time of the day. And I just could not get over that. Why is he getting paid almost 3 times for an examination to look at and examine two eyes? And I have a 32 teeth and all of the oral cavity associated with it. And it just blew my mind. And it was almost like it was like a light bulb went off. Why am I doing this? And so I had taken a course probably about a year and a half earlier, almost 2 years earlier in medical billing. And it had been brought to our attention that, hey, all of these things that we do every day for patients can be sometimes medically necessary treatment in the mouth,
Absolutely.
secondary to something that has happened in the rest of the body. Let's look at diabetes. We all know that diabetes can have a profound impact with the periodontium and how the mouth actually responds to certain things. We see inflammation all the time. We're sometimes the first person or the first physician that can actually talk to a patient and let them know, hey, this is going on. I think you may need to go and see your primary care physician for another review and have some testing done. We're sometimes the first people to alert them to that. And so when I had taken the course, I was excited. But then, you know how life is. You have a dental business, you have an office, you have a family, you have sporting events you have to get your children to, you have all these different things going on. And sometimes you just don't implement. But when I got that EOB, that 18 months to 2 years after I had that first introduction to medical billing, and I saw that, I knew I had to do something else. And so I just jumped right into it. I started taking course after course after course, learning how to do this, understanding better what I could offer my patients, how I could get it done. And if you are in the medical billing profession, it is sometimes a lot that goes on, just like with us in dentistry. But if we can learn dental insurance and how it works, we can absolutely learn medical insurance and how it works, because we're only doing so many procedures: crowns,
Mhm.
veneers,
Mhm.
extractions due to pain and infection, third molar extractions, root canals, orthodontic treatment for children. All of that can be billed to medical. The teeth only go where the jaws will allow them. That's the reason why orthodontic treatment can be a medical billed procedure for children who are getting palatal expansions, who are getting other things done in the mouth to try and make room for those teeth because the jaws and the muscles just didn't grow in the way they were supposed to. And all of those are in the oral cavity. And the oral cavity is a part of the head and neck region, which is all attached to this one thing we all have called the body.
Mhm. Yeah, beautiful. So I was today years old when
I love
I
that.
learned. Yeah, so I'm learning something, and I'm sure other people are as well, like other dentists, because of course I know that when you're thinking of it, you think of oral surgery. Yes, we can probably bill oral surgery, maybe even some implants if it were an accident or something of that sort.
Mhm.
But I was today years old when I found out that you could bill orthodontic treatment for children
Yes.
through their medical. It makes
Yes, you
perfect
can.
sense.
Mhm.
It really does.
Yes.
So, and I imagine sleep apnea
Oh,
appliances.
absolutely. Well, sleep
Mhm.
apnea is a medical condition, and
Yes,
how the dentist is able to help patients with an oral device
right.
is a dental treatment for a medical condition, and that's the reason why it's medical. Honestly, sleep apnea devices are some of the easiest devices to get paid, and dental offices can get reimbursed anywhere between $4,000 to $6,000 for one appliance for a patient. And so it can be pretty lucrative for an office in order for you to be able to thrive. And then, of course, when your offices thrive, So do your team members. If team members want to try and, talk to their doctors or whoever owns the practice about getting something as simple as, I don't know, maybe they want a shiny stapler and they want a special one that has their initials on it because it's going to help them do something quicker. Well, if there are extra funds in the practice because you've been able to access another source of income in terms of medical billing, that can help those team members be able to be happier too. Because when they're happier, typically the owner is happier as well.
Exactly. Yeah, the happy team, it makes the atmosphere run smoothly. It just changes the whole outlook of the practice. So that's
Exactly.
so yeah, that's really amazing because we're doing those procedures anyway, right?
Every day.
Every day, we're doing them anyway, and we're oftentimes with dental insurance being reimbursed really small amounts. Sometimes they don't even cover our lab expenses, less known the overhead in our team and so forth. So just knowing those procedures. So let me ask you this: you do courses on this, right? You
We
teach
do.
this. Okay. So
We sure do.
what is your website for? You have a website for your teaching, correct?
We sure do. It's
Mhm.
professionalauxiliarytraining.com. So it's PROAUX is in X-ray training.com. So that's oxtraining.com, and it stands for professional auxiliary training. So I again started this company back in 2017 when I learned more about the things that were going to help me be able to help my patients more, because when we help our patients we can help ourselves. There's nothing wrong with thriving in business. I mean, that's the reason why we're part of the business community. We support our communities, we support our patients, we support our team members, we support our families with this thing called a dental business. And so, again, as long as we can help those patients, we're going to be so much more successful in terms of how we're able to do it. We do these treatments every day. I had recently spoken to an endodontist who was in my last course, and we talked about how almost everything she does is a medical billing procedure. Patients come to see her because they're in pain. Patients come to see her because they have infection. Patients comes to see her because they can't sleep at night and they're swollen and they have all of these different things, all of these signs of infection. All of that's medical in terms of what can be done and how it can be done. So again, my website is prooxtraining.com. We have courses that are virtual, so we can make it convenient as possible. We also do in-office training. That means that we actually travel to dental offices to help them to incorporate medical billing into their practices and be able to implement it. If you send one person to any course, the only person who's really going to get it and potentially not get it is going to be the person who went. If you have your entire team involved, imagine how much more efficient that can be. Imagine how much more quickly you're able to implement whatever those strategies are going to be into your practice to be able to thrive quicker. The sooner you get it done, the better off you can be. And the quicker you get it done, the sooner you can enjoy the benefits of all the things that are going to be associated with medical billing. So yes, we absolutely go out to offices. We help them to try and implement this. I do always suggest that the doctor as well as a biller will come to the actual virtual course, because when you're dealing with medical, you got to always remember it's the body. There's some terminology that your biller is not going to understand that will need to be included because you're talking to physicians. You're going to be talking to nurses. You're going to be talking to people who use certain language. They don't talk about cavities. They don't talk about gum disease easily. They don't talk about any of those things. They don't talk about x-rays. They're not talking about teeth. They're not talking about that. They're talking about other different things as a part of the body. So if you only send your biller, sometimes it's a little bit more challenging for the biller to understand some of the language. And we just don't want them to get lost, because when they get lost, they can't teach you.
I totally agree. Anytime the doctor is getting any type of training, and in this case, it would be the biller, like you said. But when we're doing other procedures or we're doing any kind of advanced training, the doctor and the team need to have that training.
Yes.
Because if the doctor gets it and they're all excited when they come back, it's just hard to convey.
Yes, exactly.
And
And then unfortunately, what you end up doing is going back to what you were used to doing,
yes.
or you just don't implement it. because, oh, I didn't get it. I didn't understand it. I thought they said this. I thought they said that. And then sometimes people learn differently. So you and I may go to the same course and you may pick up on certain things that I didn't because of my learning style. And then vice versa. There's some things that I could pick up that you may not have. And when we have conversations and training opportunities together, we can put all those things into one basket and come up with a better way to get things done.
Yes. Love it, love it, love it. So let me ask you this question, because obviously, just like you said, there is a learning curve. So with some of the offices that you've worked with, what are some of the challenges when they go from, doing it the regular way, billing it to the dental insurance companies, and then transitioning to doing some of the medical coding?
Of course. Great questions. The main challenge, honestly, is understanding the language. We spend a lot of times making sure that when we go through the virtual course as well as the in-office training, we talk about all of the different types of activities that are associated with medical billing, because you have to learn. You don't hire a person who's never had dental insurance training and then expect them to be able to go in and file your dental claims, and get paid 100% on everything they submit when you haven't trained them. And so if you send them to a training, though, and they are among other people who may or may not know, and they get lost, they still can't come back and help you. And so honestly, that's one of the biggest challenges, is having offices understand that it's better to have multiple people in the training so they can exchange ideas, so they can exchange the knowledge that they've gained, so they can work out a plan of action so that they can put it into place. That's number one. Number two, sometimes even though we give very specific codes for, what to do and how to do it, especially if you're billing certain procedures, sometimes people just, because there's so many things, I should say, on Google, they sometimes forget that, oh, I have all of this information right here that Dr. Lowe already provided me through professional auxiliary training. And they forget to go through that and learn that. And so they start picking up other pieces of data, and sometimes it just doesn't work. Because if you don't follow what the physicians and the nurses expect to hear and see in any of your documentation that you send, the answer is going to be no. But it's the same way in dental. As a dentist, I like to say when I'm in my course and I'm teaching, hey, how many times, dentist, did you have to cut a 30 or a number 19 occlusal preparation before you were able to actually go into the mouth and do it? It wasn't once.
No.
It wasn't twice.
No, ma'am.
It didn't take 6 hours, because that's how long our virtual course is. It took more than 2 days for you as the dentist to be able to comfortably be able to prepare a 19 occlusal and be able to move through the whole process of treating a tooth. It's the same thing with dentistry in terms of medical billing. You're going to have to start from point A and then work your way to Z, but it can be done easily. And you're only typically billing the same procedures all the time, because this is all we do as dentists. There are about 12 different procedure codes, maybe 14. And depending on if you're an orthodontist or an endodontist or an oral surgeon, you may have a couple more. But for instance, an endodontist, typically they're going to be 8 codes and that's it. They're only going to be billing 8 codes. I think your team can learn how to bill 8 codes proficiently and efficiently if they have the right training. And if you do it. Sometimes things get hard and we just think, this is too hard. I don't want to do it. I thought I could, but maybe I can't. And then I always like to go back to this. Serena and Venus. I think everybody knows who Serena and Venus Williams, who they are. They didn't get to become the greatest tennis players in terms of worldwide knowledge and worldwide recognition by saying, oh, you know what? It's too hard to learn how to play tennis. And that is for any person who does anything really, really well. If they had stopped, they wouldn't be where they are today in terms of being the best at what they do. So everything is hard in the beginning if you don't know how to do it. Driving is hard if you don't know what the P means, the R means, or the D. Try to drive and have it in R and see what happens. You're going the wrong way.
Right. Yeah, like you said, everything is hard until you learn how to do it, right?
Yes. Until you
that comes with practice and training.
You got it.
Practice,
then it's easy.
constant training. what is it? Wash, rinse, repeat. Wash,
You
rinse,
got it.
repeat. So yes. So I guess in terms of that, on the flip side, successes, some of
Mhm.
the offices that you've worked with.
Oh, sure, of course. So once the people have learned what it is that they're looking for and how to get it done, and all they do is copy and paste. We just talked about, rinsing and repeating, brush, rinse, repeat. And
Right.
don't forget the floss, but still,
Only floss the ones you want to
don't
keep,
forget
right?
that part. You just repeat it. Just keep doing it. It's copy and paste. Remember, you're doing the same procedures over and over and over again. Patients are coming to you mainly with the same issues in terms of what are their clinical presentations that will allow you to be able to access medical benefits for them because it's medically necessary treatment. They're only going to be certain ones. And so once you know how to do that, you just copy and paste, copy and paste, copy and paste based upon whatever the particulars are of that one patient. But if you have patients with diabetes and now they need SRP, and SRP is a billable code and one that you can get paid on with medical, all of the things that go along with it, you can get paid for that in or through medical billing. If you've done all of that, then great. You're going to keep doing the same thing over and over and over, the same codes. There may be 2 or 3 codes that are associated with SRPs, and that's it. Implants, like you talked about, implants have to do with reconstruction of the jaws. Medical has no concern about a tooth. The only way they're concerned about teeth is it has to be because a person is having difficulty maintaining their nutrition. And if they can't eat, and if they can't masticate, and if they cannot process food properly, then yes, they may actually always pay for teeth. Not may, they will, but it's all based upon plans, just like dental. Every plan has a set of codes that are acceptable. And then once you know what's acceptable, you do it. But we've had people, I've billed $200,000 and collected at least 180 in 1 year from medical. And if you have an accident, it's pretty much a slam dunk because medical will pay for accidents in the mouth.
Right.
Patients aren't looking just to get that $1,500 or the $2,000, whatever their dental insurance is, because we all know a lot of it hasn't changed since the 1960s.
Right.
How can you get a $1,200 policy today that is supposed to help you to sustain yourself and be able to help you to smile with confidence and be able to eat and chew? And you can't buy anything today that you could in 1960, but it's the same benefit. That is just ridiculous today.
I agree. You can't buy a Coca-Cola for what you bought in 1960. Right. And our patients are still getting the same benefits.
Couldn't
They're
even get a
still getting
sip
the same
today
benefits.
for that same price. Not even a sip.
Exactly. So $1,000 then, and then $1,000 now, some
Yes.
40 years, no, longer than that later.
Yes. 40
Exactly.
was 2000. This is
Yeah, I'm like 40 years
2024.
later.
This is almost 65. This is 64, almost 65 years later because
Yeah.
it's now July.
And they're getting the same benefits.
Ridiculous.
That's absolutely ridiculous.
Mhm.
So, I'm so glad that we've had you on the show because this is some really, really good stuff. I mean, it is really, really good stuff. I go into a lot of offices and I get to observe a lot of teams, and I see a lot of things that different offices are going through. I see the frustrations of the practices, the teams, dealing with insurance.
Mhm.
And this is good. I don't see many offices that are doing what you're doing. So
Mhm.
you're doing God's work, as they
Well,
say.
thank you. Well, thank you. I
This is
appreciate
good
that.
stuff. So I
But
hope people are listening. And I'm going to put your information, of course, in the show notes. But I think that all dentists need to hear what you're doing and
Mhm.
what you're doing.
And know that it is possible. I'd said that I had built something, and I build things because I know what to do. But that's
Right.
the reason why I teach others because they can do it too. I've had other people who've been able to build, multiple treatments for patients who had accidents, things that they weren't going to do before. Something as simple as a pano. A pano, if you had one just done and you were having an accident and now you needed to check to make sure there's not a fracture in the maxilla or a fracture in the mandible, you need a pano today. Well, if you had one less than 3 or 5 years ago, based upon the frequency of that dental plan, they don't care that you almost died in this accident. They don't care that the patient is here in pain and you're trying to help them. They don't care. The frequency is the frequency. Well, guess what? There is no such frequency in medical billing. There isn't. You could get your leg repaired if you had a joint that had to be replaced, or and you had to have joint surgery. You could go in there multiple times into the same knee having the same procedure done. But guess what? As long as you have the coding proper, I should say, excuse me, as long as you have the coding properly annotated on your claim form, it's going to be paid. And remember, after a certain point with medical, the patient doesn't pay anything else because they've reached their maximum out of pocket. So once they've reached that goal with their treatment, they're not paying anything else. And then everything else is just great for them because they had no idea that their dentist could do this. I get so many accolades and I get so many people who thank me. And, it's not because that's not the reason why I'm doing it to get the thank yous. I mean, they do help. They help me feel better because, patients are always saying, I hate the dentist. Well, when you get
Oh
one
yeah,
who
who
says,
hasn't heard
I'm so
that?
glad you helped me with this, because no one else has ever said this to me. I've been to a lot of dentists in my life, and not one person ever told me that because I have asthma and now I have all of these cavities because I become more prone to it because of all the dryness in my mouth and the salivary flow that is no longer doing what it's supposed to do, how it's supposed to do it. I just have all of these things, and my mouth is just breaking down. But no one has ever told me that, hey, this is a medical condition that you're suffering from. It's not just your teeth. And it's not. But if you talk about teeth to them, the answer is no, you need to go to dental. That's the reason why you have to learn the language. And that's the reason why you have to come over onto our side of the world with prooxtraining.com and sign up for the next virtual course. Sign up to have us come in and train you and your team on how you can do this, because you can be successful too. I have a lot of clients who are successful, but I also have a lot of clients who are just like me in terms of how I was at the beginning. Remember, at the
Yeah, you
beginning, I
said you
said
waited,
it took
what
me
you said,
several years to
18,
get it.
18 months you waited before you.
Exactly. It took me seeing something. It is that was no pun intended, because I talked about the fact that this guy,
You did.
it was an optometrist who was over there looking at 2 eyes, and I'm checking 32 teeth and everything else associated with it, and he's getting paid 3 times for an exam. We know sometimes we only get $25, $32 for an examination. He's getting $70, $80 for 2 eyes. Oh, anyway, I'm sorry.
But we don't know what we don't know,
We
right?
don't know
We
what we
don't know what
don't
you
know,
don't
and we're
know.
here to help to spread the
That's
word.
that's right. And so I hate to like belabor this, but as you're talking about this, I'm learning more and more and more.
Mhm.
Because xerostomia, dryness of mouth,
Yes.
medications
Mhm.
cause our patients to have xerostomia,
All the
dry
time.
mouth. And you can build these things.
K
I hadn't heard
11.7.
that. What was that code?
K 11.7.
K
That's the
11.7.
diagnostic code. You have
K
to have a
11.7.
diagnosis code, and then you have to have a procedure code. But yes, if you're doing a filling on a tooth, if you're doing a crown on a tooth, even veneers, remember, sometimes can be paid. But everything is based upon, again, the plan's policy.
Mhm.
Just like in dental. If they have the coverage, they have it. If they don't, they don't. You tried your best, you found out for them, but you're gonna have to sometimes dash some hopes. But what we tell patients is there are no guarantees. Just like with dentistry and
Mhm.
dental insurance, there are no guarantees. And the insurance company will be the first person to tell you when you call them on the phone. There are no guarantees of payment until services have been rendered and a claim has been filed on your behalf. And they say it with a smile, and they just keep repeating it
Exactly.
over and over and over and over. There are no guarantees of payment. So as long as you understand the language, you know what to do and the steps, you'll be fine. You'll be successful. You'll have so many patients. You'll have so many, and they'll keep referring other people to you because nobody else has ever done that for them.
Nobody's doing it.
And your friends and family will too. I get calls from my friends all the time about their parents. I get calls about things that are happening with them. Hey, I remember I saw you on your Facebook Live and you were talking about this, or I saw you on your Instagram and you were talking about this. Oh, hey, I saw your article in the health magazine. Tell me more about this, or can you help me with this? Of course I can help you.
Of course you can.
Of course I can.
Okay, so I was going to ask you,
Mhm.
what do you find most fulfilling Now, I heard you say when patients say nice things, like you're not doing it for the praise, but it does help.
Yes,
Because how
it
many
does.
dentists have not heard, no offense,
Hmm.
I hate the dentist. We
Exactly.
all hear
Every
that,
day,
right?
at least
Like
three or
it's the
four times
first
a
time
week.
we heard it. Yeah, so it's good to hear some, some positivity,
Mhm.
and some appreciation and gratitude.
Yes.
What do you find most, let's see, rewarding about helping your dental clients?
So what I find most rewarding, honestly, and it's so cliche because we're in dentistry, but it's true. When patients are able to look at you and smile, whereas they couldn't smile before you started to help them. When patients are able to say to you, I really, really appreciate the fact that you're the only person who has tried to help me, even if it doesn't work. You tried to help me. Those are the days that make it really, really fulfilling. And then, of course, when I have my little pedo patients who come in and they're like, "Hey, Dr. Lowe, I'm so glad to be here." And I was like, "Wow, you are, because you're the only person who's told me this today." All of those things make you feel better. All of those things make you smile inside and say, you know what? Sometimes all of this stress is worth it just to hear these words from these patients and know that they legitimately mean it.
Yes, yes, yes. That's beautiful. That's beautiful. And two more questions.
Mhm.
So, how do you juggle it all? You have career, you have you're a dentist and practice owner. That in itself is a huge responsibility. A practice owner, business owner, career wife,
Mhm.
and you have this
Mom of two.
business.
Exactly.
Oh, and mom. Yes, and
Mhm.
that too. One of
Yes,
the most
mom.
important roles.
Thank
So
you.
how do you handle it all? How do you
Uh, I handle it all with a lot of deep breaths. I handle it all with a lot of praises to a higher being. I handle it all with a very, very supportive husband. I mean, my husband is absolutely amazing. I tell him this all the time, although he says, "You don't tell me enough," but
Well, we're gonna
and I
let
know
you
he
hear
means
this.
it.
We're gonna let him hear this, and you can play
Yes.
it back. Say,
We'll
rewind.
replay it for him. See, I did mention you. See, I told you I was going to, and I do it. But he's just so supportive in terms of what he does and how he does and how he helps out. But it is tough. When I went to dental school, I already had my two children. I had an 8-month-old and a 3-year-old,
Oh,
and
my.
so I know that things are possible because it has happened to me, and that's how I know incorporating these types of strategies into your practices can be helpful and can be done. Helping more patients can be done. Being able to be a little bit more efficient in how we run our practices can be done. That's the reason why you talk about, the efficient practice and what do you do and how do you do it and how do you get your teams on board to do certain things. Your teachings and how you come into offices to help people, all of that is helpful, so very helpful to dentists across the land because we need things like that. We need to know that, hey, you can do this. We need people to come in and talk to our teams and say, hey, team member, this is what's going on. Tell me a little bit about how you think you can help make all of this better. And we need an outside influence. And so I thank you for having this platform and for you being so willing to come into offices and help us as well, because, I know I'm really, really appreciative.
Well, I appreciate that, and we appreciate you. And so that definitely sums it all up. I thank you so much for coming on the show. Um, you're just a ray of sunshine. And
Thank you
I
so
say
much.
that, and when you all watch this podcast, because you can listen to it and you'll also be able to watch it, you will see that her energy beams and it's like coming through the screen. And so it's just it is, and I know the patients love you for that as well.
Well,
So
thank you.
you're just you're a very good example because you're a mom, wife, business owner, vet. We didn't say that
Yes.
you're a veteran,
Veteran too.
but you're also a veteran. So thank you for your service.
Thank you.
So thank you for coming on the show.
Absolutely. Thank you for having me. It was fun. I enjoyed it. And I can't wait to hopefully do this again.
Absolutely. We will definitely have you back on the show. We're going to do our best to let people know about prooxtraining.com
Yes.
so that we can get more dentists to be able to help their patients. Most importantly, you're doing these procedures anyway. you may as well get reimbursed for them.
Yes.
You may as well get more access for your patients.
Yes. Maximize more reimbursements and help more patients.
Help more patients. So this concludes another episode of the Efficient Practice Podcast. Please like, rate, and review the show. And we will see you on the next episode. And until then, take care and be well.
Thank you for listening to the Efficient Practice Podcast with Dr. Evelyn Samuel.